Hey there, friends. It's Pharmacist Michael, back with another important video that just might help you or someone you love stay safe and healthy. Now, let me ask you something. Are you or a loved one taking metoprolol for blood pressure, chest pain, or maybe even a heart rhythm problem? Because while this medication can be life saving, there are some side effects you definitely don't want to ignore. And today, I'm breaking down the top 5 metoprolol side effects that patients tell me about in the real world, and what you should do if you notice them. So let's get into this. Well, metoprolol is a beta blocker, and that means it works by slowing down your heart rate and reducing the force of each heartbeat. That makes it great for things like high blood pressure, angina, which is chest pain, heart failure, post-heart attack support, and even certain types of arrhythmias. There are two common forms: metoprolol tartrate, which is short-acting, and metoprolol succinate, which is extended release. It's one of the most prescribed heart medications out there, and for good reason. But that doesn't mean it's without risks. Let's kick off with a big one: fatigue. I'm not talking about just being a little tired. People on metoprolol often say, "I feel like I'm dragging myself through the day. I just don't have any energy." Why? Because this medication slows your heart rate down, and for some people, it can feel like everything is moving in slow motion. If you're feeling exhausted, dizzy, or weak, especially when standing up, it could be your dose is too high or your heart rate is dropping too low. Always talk to your provider if this happens. Speaking of heart rate, bradycardia is another one you shouldn't ignore. Bradycardia means your heart rate is dropping below 60 beats per minute, sometimes even into the 40s. Now, for athletes or people who work out a lot, that might be normal. But for others, it can cause lightheadedness, fainting spells, or feeling like your heart is skipping beats. If your smartwatch or fitness tracker shows consistently low heart rates, or you're feeling off, get checked, especially if you're also taking other medications that lower heart rate, like diltiazem or digoxin. Next up is shortness of breath, and this one surprises people. Metoprolol can narrow the airways slightly, especially the tartrate form. So if you have asthma or COPD, it can make your breathing worse. Even if you don't have lung disease, some people feel winded climbing stairs or notice a heavy chest feeling. This is one of those side effects that can sneak up on you. So if breathing feels harder than usual, don't brush it off. Number 4, mood changes. Not everyone experiences this, but some people on beta blockers, including metoprolol, report feeling more depressed, less motivation, and brain fog or trouble concentrating. We don't fully understand why this happens, but it's possibly due to reduced adrenaline activity in the brain. But if your mood dips after starting metoprolol, or you notice increased anxiety or sadness, bring it up to your provider. Mental health is just as important as heart health. Last but not least, cold extremities. Metoprolol can reduce blood flow to the hands and feet, which means your fingers or toes might feel cold, numb, or even turn pale or bluish in some cases. This usually isn't dangerous, but it can be really uncomfortable, especially in colder weather. Layer up and talk to your doctor if it becomes severe. And here is a quick bonus tip: metoprolol isn't for everyone. It should be used with caution in people with asthma or COPD, diabetes because it can mask low blood sugar symptoms, and heart block or very low resting heart rates. and never stop it suddenly. This can trigger chest pain or even a heart attack in some people. Always work with your provider if you need to adjust your dose. So, what's the bottom line? Metoprolol is an excellent medication. It saves lives and helps millions of people manage heart conditions. But if you notice severe fatigue, low heart rate, shortness of breath, mood changes, or cold hands and feet, these aren't just inconveniences. They could be signs your dose is off or the medication just isn't right for you. Don't wait. Talk to your healthcare provider. And as always, never make medication changes without professional guidance. If you found this video helpful, please give it a thumbs up. It really helps the channel. And let me know in the comments, have you experienced any of these side effects on metoprolol? Don't forget to subscribe for more pharmacist-approved health tips, medication insights, and wellness strategies. Until next time, be happy and be healthy. My name is Pharmacist Michael, and I'll see you in the next video.